Let's check in with Doug Leonard from ASI, Audiological Services of Iowa, for some sound advice. And Doug, there's a difference between buying hearing aids and fitted hearing aids. And there's a big difference right there. You can go buy hearing aids pretty much anywhere, but to have them work the way you need them to work, you need to have them fitted.
Yeah, I mean, the fitting component is the key to success. And that's where a knowledgeable, caring professional is so important. I was thinking about this the other day, just from the idea that, people come in and some say, well, I bought hearing aids at Costco. I bought hearing aids online. I bought whatever. You'd never hear that from someone if they had their knee replaced. You'd never hear that from someone when they had cataracts removed. In both of those situations, a knee replacement, you are having a prosthetic device that, you're using as well. Same thing with cataract replacement or removal. They're putting in lenses when they take the cataracts out. But you think about the skill of the orthopedic surgeon. You think about the skill of the ophthalmologist in doing that eye surgery. You don't think about the prosthetic itself. But for whatever reason, in the hearing care world, people are focused on that. And you think almost retail versus healthcare.
Yeah, you don't want to go in and say, yeah, just give me the generic knee. Nobody's going to do that, right?
Yeah, you want that surgeon to understand what your lifestyle is, what activities you do, how your knee bothers you right now. They want to have some empathy. You want them to listen to you. You don't want to just go into that examination room and have them turn around and look at their computer and not pay any attention to what you're saying. You need to have a good working relationship with that medical professional, and the same thing with your audiologist.
And again, the word, when you are fit a hearing aid with somebody, you really take a deep dive into where they go, what kind of hearing problems they have. It's really getting to the root of the reason why they came in.
Yeah, it starts, with a very thorough, comprehensive evaluation, not only of the sensitivity of their ear, but about their ability to separate speech from noise, doing a deep dive on that. And then, a very thorough counseling session where you're trying to understand, again, like you said, does this person need their hearing aids to hear better at church? Do they need it because they work somewhere and in their work environment? They spend a lot of time with their grandkids and their family, and that's where they want to hear better. Whatever. You need to know what that person needs out of their devices, because people have a lot of different choices.
And you provide follow-up care. If they're having an issue in a different way, that you address that as well.
Absolutely. When patients come in, first of all, most patients, when we're talking about hearing aids, after their evaluation, their consultation, we're doing a demo with them. So they're test driving those devices prior to paying for them, which is great for both parties involved, honestly, myself and the patient. But once they get their hearing aids, we are doing follow-ups on a routine basis, especially long-term. We're doing every 6-month check, or we're doing 6-month checkups. So they're coming in, having their hearing aids cleaned, and then we're evaluating their hearing every year.
Yeah, when you buy hearing aids from somewhere, you're getting a product that's never going to change. When you go to professionals like Doug Leonard, you're getting something that is going to be fitted for your certain circumstances and situations, and a much better product also. So Doug, what's the number here at ASI, Audiological Services of Iowa, if somebody wants to come in and talk?
Yeah, I would love to hear from them, John, 792-5933.
And you're here in town how often?
I see patients here Mondays and Wednesdays.
All right, give them a call and ask them any questions that you might happen to have. Great folks at Audiological Services of Iowa.